Hi, I'm Lucas.
And I'm Sarah, and we're the hosts for today's episode of Dose of Pharma.
Yeah, so today's we have a very special guest from Parkville faculty who will be covering about where research as a career can lead you to, as well as drawing on the similarities and differences between research and industry. And lastly, he will introduce about a new course, Masters of Pharmacy at Parkville Monash.
Our guest has studied pharmacy and progressed into a PhD and postdoc doing peptide molecular modelling, and this has enabled him to travel the world while studying and researching. Ultimately, he ended up being a lecturer at Melbourne University where he ran his own research lab and has now transitioned over to Monash Uni as the course director of the new Masters of Pharmaceutical Science. So let's welcome Tony Hughes.
I guess we'll just jump straight onto the questions.
Yeah, sure.
Tony, we know that you're a lecturer as well as this year you've been stepping up as the new course director for the Master of Pharmacy. So can you tell us a bit about your career and about what your specialization are? Just to let our viewers
give us a bit of a picture of what you do.
Yeah, yes. Let them know about your background.
Yeah, sure. So I actually studied pharmacy. I studied at Monash, but when I studied there, it wasn't called Monash. It was before that. It was the Victorian College of Pharmacy, exactly the same campus. I think we were one building less than you have now. So I studied pharmacy, but the pharmacy degree then was more like the Bachelor of Pharmaceutical Science with a bit of pharmacy stuff thrown in. So it's very much more a pharmaceutical science degree than you would do now as part of pharmacy. So I did that, and then I did a master, what was called a Master of Pharmacy, which was basically a master's by research, and that was also at Victorian College of Pharmacy, now Monash, and that was in the area of computer modelling, like computer molecular modelling, which was really a kind of big thing back then. This is 1985, and this was going to be the technique that was going to solve a lot of problems with drug discovery. We were going to be able to just design drugs, and it's helped, but of course it didn't solve all the problems, as all of these things never do. So I did that master's degree for 2 years. I then went and did my PhD at the School of Pharmacy at the University of London, which is now the School of Pharmacy at University College, the University College Pharmacy in London. So again, change of name of the institute. So I did my PhD there, and that was strangely in synthetic chemistry, in synthetic organic chemistry. And I never felt that I was an expert at that or was very comfortable with that. But, you do a PhD in it, right? That's how it goes. And then after that, I went to Germany and did a postdoc. So I spent 4 years at what was called the Max Planck Institute for Psychiatry. It's now called the Max Planck Institute for Neurobiology, so another change of name of institute. And I worked there on a completely different area. I worked on cellular and molecular biology as an area of science and looking specifically at neurotrophic factors. So I spent 4 years there, and then I went which is in Munich, and then from Munich I went back to Melbourne and took up a job initially as a lecturer in the Department of Pharmacology, which is now the Department of Molecular Biology and Pharmacology, I think it's called, at Melbourne Uni. So another change of name of institute that I've been at. And I spent 25 years there, lecturer, senior lecturer, associate professor, ran a research lab, and my research lab pulled together molecular modelling, synthetic chemistry, and cellular and molecular biology. So all those things that I'd done as part of my training to try and make small molecule mimics of growth factors. And we started off with neurotrophic factors and we ended up with neurotrophic factors, so a bit of a circle with that. And then mid-pandemic last year, I left Melbourne Uni and had a week off, and then started at Monash Uni. And my job here, apart from to do some awesomely good fun face-to-face teaching with you guys, is to be the director of the new Master of Pharmaceutical Science. So I'm helping to establish that program, and we'll make sure that that program runs okay when it begins in semester 1 of 2022, which is next year. So I think that's
a very diverse and huge background. Before we expand more into what your research was like and what you're doing now, a lot of our viewers may want to travel when they're a bit older or when they graduate. What was it like studying in different countries?
Yeah, that's a really really great question. And that was probably the most important bit of it, I think. The work that I did and the studies that I did, a PhD in chemistry. I could have done a PhD in chemistry. I could have continued chemistry studies at Pharmacy College at Monash Uni. Neurotrophic factors I could have done down the road at WeHi, at Walter and Eliza Hall Institute. So there was absolutely no question if I'd wanted to work in those fields, I could have done them without having left my hometown, without having left Melbourne. So the opportunity to travel was really the kind of driving reason behind doing those things. And the areas that I ended up studying and working in were just by chance. It was literally, they were just fortunate things. I went to the UK because my boss, who was the head of the chemistry department here at Pharmacy College, Peter Andrews, knew the guy that was the head of the chemistry department at the School of Pharmacy at University of London. And I went there thinking I was doing one project, and I ended up doing another completely different project because Willie, the boss, changed his mind completely while I was in between Melbourne and London. So it's completely chance that I ended up doing that. Same, the neurobiology thing, I thought it would be nice to learn something outside of peptide chemistry and molecular modelling. And I thought, well, molecular biology, that's a kind of cool area. So I just wrote to a bunch of places, and I for some personal reasons, I wanted to spend some time in Germany. And the chance came to go there. So the thing, I guess, with studying and working somewhere, you're not a tourist. You go there and you live the life of the person there. You're in that country. You have a house or an apartment or whatever. You have to go to the shops. You have to learn the language, whether it's another version of English or whatever it is you're doing. And it's completely different to being a tourist. And it's a sort of opportunity that particularly when you're young and you don't necessarily have all the connections that you've got to maintain, you can just sort of go and do something like that. And it's harder to do as you get older. So it's a really great opportunity when you get a chance to do it. Now, at the moment, of course, it's really weird because none of us can travel easily. We can't even travel within our own cities easily. But eventually that'll change. And I think when it happens, people will once again realise the importance of being able to go and spend an extended length of time somewhere else. Having said all that, I got really homesick at various times. And when I eventually wanted to come back, it was a really strong desire to come back. And it was to come back to familiar stuff and to family. And that ended up being a really important reason to come back home.
Yeah, so you had to gain a massive sense of independence, and you couldn't really just enjoy it for what it was. You had to assimilate yourself into that environment quite quickly. Was that an easy transition for you, or was it quite a new experience? It's
like you know something. So I don't think I was a very mature young person. So when I went to England, how old was I? I was 21, I think. And I didn't know a lot of stuff. I was pretty naive. And so I arrived I'd never been outside of Australia before. And I did a quick trip through America, which was kind of really, my first foreign country. And I arrived in London, and I'd never left Australia before. And it was yeah, it was just really a kind of wild ride. But it was also, I didn't finish my master's degree before I left. I didn't finish my thesis, I should say. And so I ended up spending a year of my PhD writing and not writing my master's thesis. So that actually made the first year of the PhD really difficult, because every moment that I thought I could be enjoying myself, I felt I should be finishing off my thesis, right? Yeah, which I should have finished before I left. And so I had this sort of kind of guilty 12 months, I think, in London, where I dealt with finishing off something from Australia and trying to take advantage of where I was and learn a new field and be in a lab and do a PhD and stuff. So that was a really kind of mentally challenging time, I think. It calmed down a little bit when I'd finished finally handed in my master's thesis, which is a crazy thing. Don't ever contemplate. I mean, I don't think you could even do it now, but don't finish something and go on to the next thing. If I'm going to give any advice to anybody about anything. So when I finished my PhD, I handed in and I left England. Like, I made sure that I finished it before I left.
So like time management was quite vital for that time period.
Time management would have been vital. Yeah, my time management was pretty crappy. So yeah, getting that stuff really happening, I think, is a really, really good thing to do. If there's a regret, is it a regret? Yeah, it's just what I was. I was just doing that stuff.
Yeah, it's a learning process for everyone, I think.
Yeah, for sure. Yeah.
So you've talked about your research. In particular, I think you have started a research on multiple sclerosis. So can you tell us about like what your research involves, and bearing in mind that most of our viewers probably won't have a solid knowledge on the research. So can you keep it a little bit simple for us?
Yeah, sure. So when I was at Melbourne Uni, I headed what we called the Drug Design Lab, and we had a series of projects where we were trying to make small molecules that would mimic the action of proteins. And we concentrated initially on the neurotrophic factors, as nerve growth factors. And of those, we concentrated on a molecule called BDNF, brain-derived neurotrophic factor. So we had a series of projects that ran over multiple years, creating largely cyclic peptides that would mimic loop regions of BDNF that bound to the two receptors that BDNF worked through. And we did this work early on thinking that we could make compounds that could be used to prevent neurodegeneration and therefore could be used to treat neurodegenerative diseases like motor neurone disease, maybe Parkinson's disease. And so we put a lot of our energy into that. And we developed these molecules quite early on. They were work from PhD students and honours students. Specifically Paul O'Leary, who was my first PhD student, an honours student, Richard Swar, and then an honours student who became a PhD student, Jordan Fletcher. So those three students worked really intensively and brilliantly on these projects. And we were interested, as I say, in neurodegeneration. And in a sense, that was probably a really difficult area to work in, because in most neurodegenerative diseases, by the time a patient's diagnosed, they've already got significant neuronal loss, and it's really hard to reverse the loss. The best you could do is kind of halt the process of further death of neurons. So clinically, it's a really hard area to work in, but that was the sort of indications that we had. Later on, there was a group working downstairs at Melbourne Uni, headed by Simon Murray in the Department of Anatomy and Neuroscience, and they were interested in multiple sclerosis. And they'd found that BDNF, this molecule we'd been making mimetics of, had some mixed effects in myelination in both the peripheral and the central nervous systems. So we gave them our compounds, and gave Simon's group our compounds, and together we looked at the effects of our compounds on myelination. And our compounds were interesting because BDNF itself could work through two receptors. And we had compounds that could work through one receptor or through the other receptor. So we could use the compounds to dissect the actions through those two different receptors. So we ended up with one compound which is able to promote myelination in the peripheral nervous system. And we've got another compound which is able to promote myelination in the central nervous system. And of course, it's in the central nervous system where multiple sclerosis myelin is lost. So we spent some years with Simon's group. We had a series of NHMRC grants, National Health and Medical Research Council grants, trying to further develop these compounds, looking either to treat instances of peripheral demyelination, or perhaps as a more significant area that is central demyelination, which multiple sclerosis is the kind of main disease there. And as it stands at the moment, I left my lab and my research career behind to come to Monash. Simon's lab's continuing with that work now, and they've got a grant application in to continue the work with a series of next generation compounds that we've made that are able to promote myelination in the central nervous system. And that's a really cool thing. The treatments currently for multiple sclerosis don't cause remyelination. They actually generally do things to modify the immune response, the autoimmune response, which is the basis behind multiple sclerosis. These compounds probably have less to do with the immune response and are actually able to cause myelination or remyelination of damaged nerves by acting on the oligodendrocytes, which are the myelinating cells. So will the compounds we have actually ever be used as drugs? I don't know that they're the best examples, the best starting points for drugs, but what they are doing is showing that if you can activate this particular BDNF receptor, it's a way you can bring about remyelination in the central nervous system. So maybe I think the really good outcome would be someone goes, yeah, we've got another compound that does this that's maybe pharmaceutically more acceptable, but will have contributed somehow to the foundation science behind that.
Yeah,
that's all kind of in another life now, because I have left that behind, and it's kind of continuing with other people.
Yeah, before we discuss your transition from research to like education, I guess you've highlighted that it's a lot of trial and error, and the outcomes aren't necessarily like, this isn't necessarily going to bear a treatment, but it's paved the way. Like, how do your team and you, when you're a part of it, deal with any of the setbacks you encountered?
How do you deal with the setbacks? So I think one of the things that a lot of people talk about, they say that research is really difficult. And you can hear that and go, yeah, it's difficult because you've got to pipette and stuff. That's not the difficult bit. So I think the difficult bit is what you've just said, is that you have setbacks, and the setbacks come in all sorts of forms. Experiments give you a different outcome than what you expect. They're experiments. So you have an idea of what the outcome's going to be, and the outcome's different. And sometimes that's really exciting. More often than not, from my experience, it's hugely frustrating. So you go, why didn't that go that way? And then you doubt what it is that you did. And when you start doubting what it is that you did, then it's really easy to kind of doubt everything that you do. So part of it is building up the confidence, I guess, with what you're doing, so that you can believe it. So when you get an unexpected result, you believe the unexpected result, or you can take the steps to show that that unexpected result is kind of the real result, rather than that you mucked it up along the way. And the other kind of setbacks you get is, so when you're doing research in an academic environment, you don't get money from the university to do it. Mostly you have to apply for funding for it, for external funding. And the majority of that money would come from the government, so form of government grants that you apply for. And there are more and more people doing science than there were when I started. And there are not proportionally more money in the system. So there's proportionally a lot less money in the system. So you apply for a grant now, knowing that you're probably not likely to get it. So there aren't many things that you do in your life where you put in, writing a grant application is probably, the actual writing the application probably takes 4 to 6 weeks. of pretty concerted effort, and it's built on work that you will have been working on over the last 6, 12 months, 6 years, whatever, to put in. So it's a big project, and it's almost certain to fail. And there aren't many things that you do in your life where you're going to put this big effort in, knowing that your most likely outcome is that you'll fail. You just, if you think I'm going to put a big effort, I'm going to cross the road, you don't think I'm going to fail crossing the road. You think I'm going to get to the other side. So you have to be able to steel yourself the fact that when you put in a grant application, most likely you won't get it, no matter how good it is, because there's lots and lots of people and there'll be lots and lots of good ones. And it's pretty hard to distinguish between that good versus that good versus that good. A lot of opinion and stuff in there. So that's really hard, because you then, not only do you not get the money, you get told all the reasons why this is not good enough. And you thought it was good enough. You know, you put in 6 weeks worth of work and you built it on 5 years of research before that. And it's, you know, you've had collaborations and you've thought about it a lot. And someone says, no, that's no good. So you got to come back, brush yourself off and come back and do it again. And I think that's that's a really challenging thing. The people that I've seen that are really successful in science just go, yeah, whatever, and just keep going. And they have a real, either have or they've built up a real strong resilience to that. So I think you need, in order to do research really well, you need to be resilient and to have built up resilience. I'm going to say you don't need to be resilient. You can learn it. Okay, so I don't want people to think, oh no, I'm not resilient, therefore I can't do it, which is something I would say. You can do better than that. So I think you can learn to be resilient. You need to have a lot of self-belief. You need to learn how to have a lot of self-belief with it, yeah. So that you believe in what you're doing, and that then helps with your resilience. And you need to have that strong sense of self-efficacy, that you're capable, and reasonable like evidence-based self-efficacy, if you like, not just I'm really good at stuff when you're actually not very good at it. But I think the worst is when you think I'm not very good at this, when in fact you're pretty good at it. And the tough thing about that in science is that your self-efficacy is constantly being challenged. What you came up with wasn't good enough. And so you've got to go, yep, it's good enough because I know it's good enough. And then you work through. So, the people I think that do really well in science have had those qualities of resilience and self-efficacy and self-belief. And got to be reading a lot and staying in contact with what it is that you're doing. But it's really easy to get like kind of challenge to get beaten down from it. So that's I think the tough bit of doing science. The experiments themselves, they're just things you can learn.
Yeah, it does sound like researchers need to persevere through a lot of challenges and be mentally strong as well, because of all the things they have to go through. I think most people in the industry probably won't ever touch on, because it's very different in terms of the mentality. It's very interesting to hear from.
Yeah. The industry question's a really interesting one. I think the challenges in industry are a little bit different, but not so different, and sometimes very much more cutthroat. So the big pharmaceutical industry will tend to change focus or want to change focus. And if you're working on a project and your company decides that's not a project to work on anymore, that project gets shut down. And if you're lucky, you get put onto another project, and it could happen Friday night to Monday. So there you've got to be able to go, okay, I'm changing my focus from serotonin to noradrenaline or whatever. Yeah. And there was a while back, probably about 12 years ago, most of the major pharmaceutical companies around the world decided to shut down their neuroscience programs, their programs to discover CNS active drugs. They shut them down. And so the people that were working on them, some of them got redeployed elsewhere in the companies, but a lot of them were just told, well, we're shutting down our program and we've got nowhere else for you in the company. So, varying degrees of transition will help and so on. But they were told they weren't needed anymore because the company decided not to do that. And the drug companies around the world basically thought that CNS research was not producing drugs, so they just stopped doing it. Things have shifted a little bit since then, kind of righted themselves a little bit, but a lot of really good scientists ended up without jobs because they were working on an area that their companies decided was not relevant anymore to them. Yeah. So there are real challenges. I don't think that industry is any more certain a research area than working in academia research. It's up to a company who if management in the company decides they want to change direction, they just change direction, and you've got to go along with that. So, the people who work in industry kind of think, the academics have got all this freedom, it's great, they can do whatever they want. And the people that work in academia think, the people that work in industry, that's great because the money kind of flows out of the ventilation system falls down on the lab bench and into the tea room. And neither of those views are true. Yeah, it's challenging no matter what.
Wow. It's kind of like scary where, obviously like at the end of the day, they're a company and they have to make a profit. So it's not always about what you're passionate about, and you're not always going to be able to take everything with you and keep working on it. It's just kind of, you have to follow one directive.
Yeah. I mean, I guess the people that do really well in industrial research can take on passion, can become passionate about something. And when they are not passionate about that because they're not working on that, they become passionate about something else. So it may be that it's not, you have to change your passion with it. So you probably need, in industry, you probably need a greater flexibility. I think your flexibility would be really valued in industry. And in academic research, sometimes I think that being the perseverance that you spoke about, I think is perhaps maybe is a quality that's really valued. But they work in both environments as well too.
Yeah. All right. Well, thank you for your advice on that. And I'm sure that's a lot for our viewers to unpack because I never even thought of it that way. But going back
one of the things I don't want to make it seem like it's really negative because I've presented this kind of really negative view. But when research works really well, it's super exciting, and you get a result that you see whatever you're doing, whether it's drug discovery research, development research, or whatever you're doing, you see something that no one else has seen before in the world, and that's really exciting. And it's come often from your own reasoning and thinking. So there's the kind of, hey, I came up with this, and wow, it's this. No one else has seen it. So that's really exciting, and it's extreme. It's really creative. I think the way society is, I think society tends to think that artists are creative and scientists are nerds, logical or something. And that distinction is really artificial and relatively recent as well too. You go back a couple of 100 years and scientists and artists were the same people because they were the ones that had read and had travelled, and so they were doing the same sorts of things. They were doing the same things. They were being creative in art and being creative in science, and creative in thinking. So science is a really creative, potentially to be a really creative thing. You learn science in a textbook, it doesn't seem creative because you learn the stuff. But when you're at the frontier, the sort of front edge, where there is no textbook for that, you're helping to write it. And your thinking then takes it in different directions. So that's the sort of, I think, the really exciting bit. There's the opportunity to be as creative as you can be and to be rewarded for that in all sorts of ways.
That's sick. So with keeping that in mind, that creativity and the skills you mentioned earlier that are vital for research, how do you plan on incorporating this in the new Masters of Pharmaceutical Science, and what's the goal of it?
Yeah, that's great, isn't it? Because what we want to do, I guess, with the new Master of Pharmaceutical Science degree is to help build up a student's knowledge of how drugs can be discovered and created, starting with what we already know, so from past examples, and then moving into unknown territory with it. And so the idea is, if we give you sufficient knowledge and skills from the past and what we know is happening and where things might go, then that puts the student in the position where they can start to make their own clever connections between things. So it's really about trying to equip you with the knowledge and with the skill set, so when you go out and you've got a problem in front of you, you've got the capacity to be able to solve that problem or push creatively from that point. So it's going beyond what you do in our undergraduate degree in Bachelor of Pharmaceutical Science, which is really getting a foundation for you. And this is now taking on that foundation, which may be a student who's come from a Bachelor of Pharmaceutical Science, or it may be a student that's come from elsewhere with another background, and going to the next level with the knowledge and skills, so that you become kind of professional ready, I think, would be the way to look at it. And the transition, I guess, we do, it goes from, as I say, kind of studying historical cases through to state-of-the-art techniques and approaches, through to an extended placement, which we think majority of people will do in an industry setting, but there'd be the capacity to do it in a lab setting as well too. And then coupled with the capstone unit, that gives you the chance then to kind of exercise your professional creativity, I guess. So what we take earlier in the degree, you then get a chance to explore it, document it, cheer about it in the final part of the program. So I think we'll end up with graduates who have appropriate self-confidence, that they'll be understand that they'll be good enough to be able to do good enough to be able to take on a lot of challenges that are present in pharmaceutical science, particularly in the areas of drug discovery development, but also in other areas of formulation and manufacture of things which require the same sorts of approaches. And with that strong foundation, it will be easy for a student, I think, to be able to adapt to those different situations. So we won't be giving you the answers. I think we're setting you up to be able to find the answers, because we don't know what the question. We won't even know what the questions are straight away, and you're going to be posed with the questions as you get out into your careers afterwards.
So, from the launch you had at Monash, I think there was an outline of the semesters and the units. So I noticed that a big part of it was based on the industry placements. So what would you say about like the benefits of the industry placements at the Masters of Pharmacy, and how important are the business sense in a sense for like us students or like potential students for the Masters in their future careers?
Yeah,
because like
again, they're really, really good questions, I think. So the placement, I think, is good because it's a 18 credit point unit. So it's 3/4 of the semester. Allows you basically to do 12 weeks of placement. And we'll have, I think, the capacity, we're going to look at the capacity maybe to expand that with some not for credit options. So you could do possibly a longer placement but not get credit points for it, where that might be appropriate. But in any case, it's a 12-week placement. 3 months, it's a substantial period of time where you'll be embedded in a company. And I think it's a real chance to learn, obviously, some aspects of pharmaceutical science. You'll have a project that you'll be assigned to in some way, as well as the sort of be involved in the day-to-day running of how the corporation that you're working with operates. It's going to depend very much on what the company is, the sort of experience that a student gets. So choosing the company will be an important thing, choosing where to do a placement. If you're in a very large company, you're probably going to be further removed from the day-to-day running of how that organisation operates. So I imagine if you were doing a placement with a pharma organisation, a bigger one, you're probably not going to have much to do with how that pharma organisation operates. If you're working with a small biotech company, you may be working, the person that's in the lab may also be the chief scientific officer for the company, or they may be the CEO for the company. So you'll be much closer to that then. So the actual experience and what you get in sort of business sense, I think will depend a lot on where you do the placement. And we'll be helping students to find appropriate placement places. We're building up a lot of experience. We have in the faculty a lot of experience with placements from the undergraduate space, and we're working also with a group within Monash to help manage that. So we'll be able to support students into that placement and, of course, support them through the placement. Also, in the third semester of the unit, we'll have a unit where we will be dealing with those professional skills, which are sort of outside of science, that would be really important for helping you to navigate your way through business and employed life. So they are important, and you can't really, being able to come in and do an experiment in a laboratory is one thing. Being able to communicate that to people is another. Being able to work with a team to decide what to do in an experiment is another thing. Being able to integrate that into a larger strategy for a company is another thing. And so we'll aim throughout the course to give examples of and give context for pharmaceutical science issues that we'll talk about. So we'll put them in the kind of industrial context, and through our professional tools unit to begin to equip students with some of the professional skills that they'll need, which they'll develop further then in the placement.
Yeah, so it's like almost like giving us all the practical skills and like emphasizing that and giving us like more commercial awareness, because it's like Lucas has another year, but it's quite daunting that at the end of the year I'm going to be graduating and going for jobs. So like it's really great that this has become an opportunity for students.
Yeah, and I think we'll have some students that might want to go straight on from a Bachelor of Pharmaceutical Science, but we'll have other students that may want to go out and work. And they may take a position for a year or two, and then realise that they could benefit from that greater equipping that we spoke of, both the kind of mental and skills equipping that would put them in a different position in industry, where they'd have a kind of greater scope to move upwards or forwards, depending how you orient your company, I guess. Yeah. I think some of our students will go straight on, and some of our students will work and come back we'll see them in a couple of years' time.
Yeah, it does sound very exciting to like learn about, just not only about like furthering the foundation, but like knowing about like the different aspects that comes into pharmaceutical science that you might not come across when you're working alone. So yeah, it's very interesting.
Yeah, I think we'll see. It'll be really interesting to compare the graduates of the two. I mean, we obviously have lots of Bachelor of Pharmaceutical Science graduates, so we know the kind of standards that they reach and the qualities that they have. And I think comparing that to what we get from a master's graduate will be really interesting exercise. We don't have those master's graduates yet, but I think if those students, if they meet the learning outcomes that we set, which they will, then they'll be much more mature, they'll be much better equipped, they'll be very flexible, and they'll be up for the challenge. I think I suspect they'll be highly sought after.
Yeah. I think that might be all that we have time for. Is there anywhere we can find out, like our viewers and us can find out more about the course and you specifically as well?
Yeah, so probably the best thing I can do is to, I'll send you through a link to the, I think it's Study at Monash site, which we have at the moment, which will be updated as it gets updated, and we'll eventually have links to the handbook entries and so on for the units. We're working on those at the moment, so I don't have the links, but through the I think it's Study at Monash page, that will get updated. If you're a Bachelor of Pharmaceutical Science student, we'll be updating you through emails and so on as the course becomes more developed. So you'll find out about things through those email channels as well too.
Yeah, we'll put it in the episode description. But thank you so much for your time. And,
pleasure. Thanks for doing it. And it's really great that you guys are doing this. I think it's really, really good.
Yeah. Thank you, Tony.
No worries. Enjoy the rest of your day. Yeah. See you, Sarah. See you.
To conclude the episode, we wish to acknowledge the people of the Kulin Nations on whose land we are gathered today. We pay our respects to the elders past, present and emerging. For those listening who may be based elsewhere, we pay our respects to the traditional owners of the land from wherever you may be listening from. We especially welcome any Aboriginal or Torres Strait Islander people listening in today.